Hello, my name is Saad Usmani. I'm the Chief of the Plasma Cell Disorders Division and the Director of Clinical Research for Heme Malignancies at the Levine Cancer Institute in Charlotte, North Carolina. And a common question that's posed to a lot of the myeloma physicians is now that we have two anti-CD38 monoclonal antibodies in clinic, namely daratumumab and isatuximab, can we retreat with an anti-CD38 treatment if someone has already progressed on one? So, for example, if someone got daratumumab before, can they get isatuximab, and vice versa? And what would be the clinical consequences of that? And is there any data to support this? So my general response is that we don't know yet. We have two clinical trials that are looking at retreatment with either daratumumab in patients who've had prior daratumumab. And we also have a clinical trial where prior daratumumab patients are being treated with isatuximab. And the data is not in the public domain yet. Even though these two antibodies target different epitopes, the mechanism of action, the responses that we see in different clinical trials with the combinations in the relapse setting, at least appear to be somewhat similar. I can share my own, experience. We at our institution we have retreated patients with daratumumab-based combinations in someone who's had daratumumab in the past. And our group, as well as Emory, have specifically published data with the pomalidomide-based combination with daratumumab, in which, yes, there are some patients who get responses, but the responses and the duration of response and PFS are not similar to someone who has not had daratumumab in the past. So I'll be curious to see what the data show. But our general practice, clinical practice, has been if we are going to retreat or rechallenge someone with an anti-CD38 and they've had it in the past, we don't do it right away. So if they're progressing on daratumumab, for example, we won't be giving them a daratumumab-based regimen as the next step. We would be trying non-cross-resistant therapy. But if their prior experience with daratumumab was 6 months or more, we would consider giving daratumumab with a mechanism of action that the patient has not seen before. So I'm hoping that in a year from now, we will have clinical trial data where I would be definitively be able to tell you guys that someone who's progressed on dara can get isatuximab or vice versa. But right now, we don't have that answer. Thank you.